My name is Oliver Holman. I'm one of the FY2 doctors at Princess Alexandra Hospital, currently working in A&E. I use the shared care records for every single one of my patients to check for their medical histories and their drug histories. There was a patient I saw the other day who was having seizures in the department. I think he had complex mental health problems, had never presented to Princess Alex before, but I checked on the shared record, and all of his records from Croydon Hospital came up. So I was able to read various letters and then find out the diagnosis. We found out what medicines he needed to be prescribed to avoid him having further seizures in the department. When you take drug history from a patient, it's not necessarily reliable. Even things like insulin prescriptions, if you prescribe too much insulin to someone, you could send them into coma or something like that. So certain medications I would only prescribe to someone if I see a written record. It definitely avoided an admission in this case, or potentially having unnecessary treatment, unnecessary scans. We referred him straight to the social services and they dealt with him straight in the community. Most patients, if you can avoid admitting them into the hospital, it's the best thing for them. Work gets repeated so often in the NHS. It's very, because of the nature of how everyone is in their own team, and that historically all the records have been broken up, and it just makes our job a lot easier when all the information is in one source.